This is Let's Talk Live.
Over 30 million people in the United States have type 2 diabetes, and 1.5 million are newly diagnosed every year. And nearly half of American adults are pre-diabetic or worse. Now, for those struggling, there is a new approach, and it may be just the right thing for you. I'm here with Dr. Stephen Wander, author of Reverse Your Diabetes, Change Your Life, to tell us more. So welcome, Dr. Wander. We're happy to see you. What made you get interested in reversing diabetes?
You know, when I was about 12 years old, my grandmother and my grandfather, they were from Brooklyn, and they took me out to lunch, and the first thing my grandmother did is she laid out 13 pills, and I was like, what are all those pills for? And she was like, well, the first one's for my sugar, the second one's for my pressure, the third one's for my thyroid, the fourth one's for the side effects of the first one. And I was like, something about that doesn't make sense.
Right.
And I saw her health go downhill very quickly, oral medication after oral medication, dialysis, amputation, and so I wanted to see if there was a different way.
Yeah, absolutely. So you're seeing significant improvements with people. What is the new approach that you have?
Well, the new approach, you know, people currently, when they go to their doctor and they're like, Mrs. Jones, Mr. Jones, I'm sorry to inform you, you're a type 2 diabetic, here, take this. And then they go down the road of oral medication after oral medication, Metformin, Glipizide, Actos, Januvia, Farxiga, until eventually the doctor tells them they need to be on insulin. And then they get this wonderful 3 pieces of advice, which are change your diet, lose weight, exercise. And then unfortunately, that's how they're recommended their treatment plan for the rest of their life. And that treatment plan has brought diabetes from the 7th leading cause of death to now the 3rd. So it doesn't work.
So what does work?
What does work is testing each individual from the ground up based on results specifically for them, and then coming up with a customized plan for them to figure out why they can't regulate their blood sugar. I mean, most people are put on medication. The reason they're diabetic is not because they have not enough of that medication in their system. So therefore, giving them that medication probably not going to give them a good outcome.
Wow. Okay, so how do you select your patients? How do you know who you want to work with?
Well, actually, reversing diabetes is actually simple.
Okay.
It's not easy, but it's simple, because once we figure out why from the ground up, like if you were a teacher and you gave us all a 25-question test and you said, hey, in a week I'm going to give you 25 questions and here's the 25 answers. Next week, everyone's going to pass the test. Why? Because you cheated on the test. So what we do is cheat on the test by figuring out all the information about what around your biochemistry in your body is not going well, and then picking a plan. So first thing is we need to do that. And then second thing is we need to find out, can you actually be successful in following the plan? Because just because we know what to do doesn't mean you're going to be able to do it. So we need to select people that are going to be able to do it and be successful.
Well, let's talk about being successful, because there are a lot of myths surrounding diabetes. Let's discuss some of those.
Yeah, the top 3 myths are you're diabetic, Mrs. Jones, because you're overweight. Weight has nothing to do with being diabetic, so it's not the cure, so it can't, it's not the cause, excuse me, so it's not the cure. Number 2, age. Well, Mrs. Jones, you've now hit blankety blank age, therefore now you're going to be diabetic. No disease is age-related like that. And number 3, genetic. Well, I'm diabetic because my mom and my aunt and my uncle and my brother, everyone else is diabetic there. Well, for type 2 diabetes, there has not been a chromosome or genetic component detected as of today. And so basically we have to take those excuses away from patients.
Oh, okay. So it doesn't mean that just because you're predisposed doesn't mean you're definitely going to have that disease.
Correct. Any disease, even if it does have a genetic component, the gene must be turned on. So we could both have the genetic component for a certain disease, but that doesn't mean we're both going to get it.
Right. So how many types of diabetes are there? I know of 2.
So most people think there's 2. Type 1, which is an autoimmune disease where the pancreas doesn't produce insulin, and then type 2. But there's actually type 3, which is known as sugar brain or Alzheimer's, cognitive decline. That's type 3. And then there's type 1.5, where the person has an autoimmune component to the case, and therefore it makes it much more difficult. So if you don't figure that out or find that, it's virtually impossible. But if you do, it's simple to reverse it.
Wow. All right, Dr. Wander, so many questions, so many answers. Where do we find you to get more information on this? Because I'm sure we just opened up the door for a lot of people.
You can go to dcfunctionalmedicine.org or call 301-770-5395.
All right, great. We look forward to talking to you. Thanks for coming in.